Buenos días, mi nombre es Andrés Sosa, tengo 75 años, vivo aquí en Miami.
It was something very subtle. When he was holding a glass of water, the hand would shake a little bit.
12 años atrás comencé de temblor en la mano.
When I first started to notice this, I was not very concerned. I mean, it's one of those things that you just sort of look at and you go, and you keep going.
Me afectaba en todo, en el comer, en hacer las labores de la casa.
This change in lifestyle gradually became more difficult because I was afraid of just leaving him alone when I went off to work. Not because he couldn't take care of himself, but I was afraid he would do something that would cause him to hurt himself by virtue of not having the dexterity that he needed and the tremors.
Yo estaba frustrado, me sentía mal porque no podía hacer nada.
When I met Mr. Sosa, the first thing, as with all patients, I want to confirm the diagnosis. There are plenty of people who come to me with supposedly a diagnosis of essential tremor.
Conocí al Dr. Sporrer, la primera visita, pues coordinamos muy bien.
High-intensity focused ultrasound refers to a technology by which we're able to cause an ablation at a very specific location in the brain. Using high-intensity focused ultrasound, we're able to create the same ablation with no incisions. And so we're able to disrupt an abnormal circuit that exists in some people who have Parkinson's disease or essential tremor or other movement disorders.
How's your arm? Looks pretty darn good to me. You feel this?
Yeah.
It feels normal, just like this? Big thumb up? Yes. Good. Good.
HiFU really represented a change like from night to day for him, for us. For me, in the sense of satisfaction of seeing him evolve. For him, in being able to do things like write that he could not do for many, many years.
I think that even if it's not a 100% cure, improving the quality of life is what being a doctor is all about.
Wow.
Oh, man.
Pretty smooth.
Me sentí como que había nacido nuevamente.
Through our experience and through Baptist's investment in this technology, we have been able to treat over 100 patients, which, believe it or not, is actually a very high volume when you compare that nationwide.
I watched him sort of like relearn how to write and being able to do things with his left hand, which is his dominant hand.
Overall, it's an easy procedure, but there are parts that, such as shaving your head, that people would otherwise try to avoid. And so he came back because his other side still had tremor.
When we received the call from Dr. Sporer's office that the FDA had actually given clearance to do a second procedure, a second HiFU procedure on the same patient, for us it was really a sense of excitement.
We finally got the FDA approval to treat somebody on both sides with high-intensity focused ultrasound. That's a huge win for this patient population because before that, you could only get it on one side ever during your life.
Today, he is doing amazing. Neither hand shakes. He is able to button his shirts and shave.
Mr. Sosa did very well getting his second side completed. I think it's a testament to how effective the first side was, that somebody would come back and go through the process again.
Yo ahora me siento bien, ya puedo cargar a mi nieto, ya lo tengo con seguridad.
To Dr. Sporrer, I would like to say thank you. Thank you because from the moment we first saw him and he entered the room, I had a lot of anxiety, I had a lot of worry, and the moment he walked in, it was like total peace.
I've been here almost 10 years and I just really enjoy the fact that we have the resources necessary to treat patients with a whole host of problems, with options for people who can't get this treatment or can get this other treatment.
Le doy gracias al doctor, a Dios, al doctor, por lo que hizo.